Welcome to Plastic Surgery 90210, and today we're going to be talking about breast implants. So there are a lot of different breast implants out there. You know, when we were first starting out with plastic surgery, there was basically one size, and then that quickly escalated into a variety of sizes. And now we have not only just different sizes, we have different shapes and profiles. Here is just a sampling of the implants that we have. We have smooth-walled implants, we have textured implants. Now the textured implants we don't use anymore. The textured implants were associated with the super rare, never even seen one type of breast cancer, so we don't use textured implants anymore. But we're left with smooth implants, and you can see by this display, they're different sizes. They're the small implants. These are 125 cc implants, all the way up to the biggest silicone implant that we have, 800 cc's. There are also silicone implants, and there are saline implants. Saline implants are filled with saline, as you would imagine. Silicone implants are filled with silicone. Now, when we have a saline implant, it literally comes to the factory like this. This is a 400 cc implant, and it has this little paper valve here that we take off. And this is a little valve, a little ball valve, that allows us to stick our little tube in. Once this tube goes in, then we're able to deflate this implant. You can hear the air going out, right? So we put the implant in, and then with this tube, wherever we've gone in from, then we're able to inject saline. So we fill it up with saline, we hook it up to this little port, and then we inject it, and the implant gets bigger and bigger. And then when we're done, we just pull the tube, and this little ball valve seals itself. So that's saline. So usually with a saline implant, if it ruptures, if there's a break in it, your body absorbs that saline usually in about 8 to 10 hours. So when you go to the hospital, they hook up an IV and they give you normal saline. That's the same normal saline that's in the implant. So if the implant were to break and the saline goes in your body, that is sterile normal saline, the same stuff you would get through your IV. So it's perfectly safe, perfectly normal. So the other type of implants we get are silicone. So these come to us like this. They come sealed. They do not have the valve like the saline does. So these come completely sealed. We can't fill them up. We can't inject more silicone, or we can't inject more saline into these. These are sealed. So when we open these are the size we're given. Now with the saline, we can adjust the size a little bit. So we can bring it up to like a 400 or maybe a 450 or 500, whatever size you want. Now with the silicone, we need to decide our size before we insert it. So are we going with a smaller implant, or are we going to go with a larger implant? So your surgeon and you need to decide that before the surgery. In my practice, I would say 98% of the time we're using silicone because it feels better, it looks better, it's more natural, less capsular contracture than the salines. Salines do have their benefit. They are less expensive. They are maybe easier to get in through a smaller incision, and they last usually about the same amount of time. These implants, they're all FDA approved. They're not dangerous. If they were dangerous, we wouldn't be doing them, right? So silicone, saline, perfectly safe, FDA approved, very, very safe implants. We only do safe surgery. So breast implants should last you a lifetime. Most patients, however, as they age, want their implants changed for one reason or another. Some patients want to go bigger, some patients want to go smaller, some patients actually need a breast lift, and the time we're doing a breast lift, sometimes we'll change out the implants, but they're built for you for a lifetime. So you should be able to keep these implants for your entire life. And they're extremely durable. So here I am squeezing it really, really hard. My favorite story is we were examining a patient for her breast implants, and as we were choosing the size, her 4-year-old child was in the corner and had taken some of the implants out of my closet, and literally he was jumping on the implants like this, jumping. And the implants were not rupturing or breaking. So these are extremely durable. Now you can go on YouTube and see some classic studies of plastic surgeons throwing implants off a building, running it over with a truck, things like that. So these are extremely thick-walled and very durable. So when we put the implants in, again, there are 4 approaches: through the belly button, through the armpit, around the areola, and underneath the breast. So the further you are away from the milk ducts that's around the areola, around the nipple, the more likely and the more able you're able to breastfeed. Also, if you place the implant underneath the muscle, you're more likely to breastfeed. With pregnancy, typically the breasts collect milk, they engorge, they get larger, and then with breastfeeding, the breasts are always getting larger and smaller depending on the stage of lactation. Then after you stop lactating, the breasts involute, or they shrink down, so you lose volume there too. So with aging and after pregnancy, and especially more specifically after lactation, then the breast gets smaller and more saggy. So in that case, you may need more augmentation, that means a bigger implant, or you may need a lift or a mastopexy associated with that breast augmentation at that same time. So we can put the implant on top of the muscle, we can actually put the implant underneath the muscle, or we can put it sort of half under the muscle and half over the muscle. Now, when we put the implant on top of the muscle, that leads to a lot of cleavage on the top of the breast. So I have a lot of patients who come in and they're like, look, I want cleavage. I want as much cleavage to show as possible. And then I'll try to push the patient towards, well, we should probably put the implant on top of the muscle. I have a lot of patients who like a more natural look. Look, Dr. Katzen, I don't want anybody to know that I've had breast implants. Can you please make it as subtle as possible? So we should put the implant underneath the muscle. Some patients want a little bit of both. In that case, I'll put the implant half under the muscle, half over the muscle. So the recovery is pretty quick after breast augmentation. It really depends on how much work is done on the muscle. Maybe a breast lift is associated. Are we putting in a small implant, a big implant? But usually the recovery is going to be about a week to 2 weeks. You'll have some swelling, you'll have some bruising, but that'll go down pretty quickly. And then we'd like you in the bra to sort of keep everything in position for maybe about 6 weeks after the procedure. On YouTube, we see some comments that all breast implants cause breast cancer. Well, that's not true at all. Breast implants have been around since 1970. They've gone through many, many trials. Hundreds of millions of patients have breast implants, and they do not cause breast cancer. Absolutely not. We actually put breast implants in patients who have breast cancer, who are actively undergoing radiation, chemotherapy, mastectomies, and we use the implants to reconstruct the breast. So why would we put an implant that could cause cancer in a patient that has breast cancer? Makes no sense. So those rumors are absolutely false, not true at all. Breast implants do not cause breast cancer. Breast implants can cause this thing called breast illness, which is sort of a collection of vague diseases thought to be associated with the breast implants. We're still studying that. Most patients do not have any of the symptoms associated with breast illness. So breast implant illness is not common. We'll know more hopefully in a couple of years. So the silicone that we're talking about these are medical grade silicone. Nothing to do with the injections that people are doing into the buttocks and the breast and the face, etc. Those silicone injections, typically the silicone that is harvested there is purchased at Home Depot or Lowe's and injected in somebody's house or hotel room, completely black market and illegal. It's not the medical grade. Now, if you take the silicone from this implant and inject it into the breast or the buttock, you're still going to have major problems. But the thing is that this silicone comes to us in a package. It comes wrapped up in an implant. It comes in a shell. So this is perfectly safe. The injections of raw silicone are not. So when you're thinking about breast augmentation, think about what kind of look you want to achieve. Do you want to go with a smaller implant, the medium-sized implant, larger implant? And then what kind of cleavage do you want? Do you want to get most cleavage possible, or do you want to get a more natural look or something in between? So I know it can be very confusing at home. We do have another YouTube video. It's called the rice test, where you can determine the size of the breast by using a stocking and some rice to determine the size of the breast, and you can do that at home. But you can also come to a plastic surgeon's office and we'll have you try on multiple different sizes of implants and determine how large you want to go. And then it sort of is important for you and your plastic surgeon to sort of get across and relate and sort of understand the shape of the breast that you want to get. Do you want to get cleavage? Well, then we're probably going to go on top of the muscle. Do you want to get more of a natural look? We're going underneath the muscle. Do you want the best of both worlds? We're doing dual plane. So thank you very much for tuning into Plastic Surgery 90210. This lecture has been all about the breast implants. Please leave your comments below and we'll see you next time.